Okay. Welcome to our webinar today, where we are going to be talking about health anxiety. My name is Alex and I work with Community CAMS.
My name's Abby and I work in First Steps. In recent years, we've all had to live with many unexpected changes due to COVID-19. We've had to get used to a completely different way of life, lots of uncertainty, and also continue to adapt as the guidelines are just constantly changing. It's understandably been a really scary time with our anxiety a bit more heightened than usual. While there's not a lot we can do about the virus, there are lots of helpful things that we can do for the well-being of ourselves and those around us. And this webinar hopes to introduce you to some tips and tricks on how to manage your feelings during this time and build up your confidence as we start to transition out of lockdown and back into our everyday activities. And we hope that you'll find them useful. What is worry? Worry is referred to at times as anxiety, and it's a completely normal emotion that everyone experiences at one time or another. It's very much a part of everyday life. People might be feeling worried at the moment as a result of the coronavirus. And when it comes to worries about health, we call this health anxiety. Worry can really affect the way that we think, the way that we feel, and the way that we behave. In terms of the way that we think, when we're worried, we tend to overestimate the danger and underestimate our ability to cope. It's really common that worries sometimes involve the term what if. For example, you might be worrying about what if I have the coronavirus and what if I spread it to my friend. Worries also affect the way that we feel. So we might be feeling uneasy, we might be feeling concerned or low in mood. And worries also affect the way that we feel in our bodies. So our bodies might experience physical reactions such as increased breathing and heart rate. We might get headaches, and some of us might have panic attacks. And lastly, it can affect our behavior. So we might have trouble sleeping, or we might try to seek lots of reassurance from those around us. We might try and avoid situations that make us feel anxious in order to understandably get away from all of those unpleasant thoughts and feelings.
Worries can be helpful at times. For example, if we are worried about catching and spreading the coronavirus, we are more likely to be motivated to wash our hands after we have come home in order to protect our family. Therefore, worries can be helpful in motivating us to take helpful action. However, sometimes worry can become a problem, particularly when it is out of proportion for the situation or there is no actual threat or danger. Some worry might be anticipated in certain situations, for example, spreading coronavirus to our loved ones. But if the worry is so extreme that it stops you from doing things or interferes with your quality of life, then it becomes problematic. Worrying can be like a spiraling tornado. We keep rehearsing our worries over and over in our mind, and we become trapped inside and have trouble breaking out of them.
When our brains are worrying and feeling anxious, they send hormones down into our bodies which cause lots of physical changes in order to protect us. This might include fighting the danger, fleeing the danger, or freezing up completely, and this is what's known as the fight, flight, or freeze response. This response is why we feel the way we do when we're anxious. So our muscles tense up to run away, our breathing becomes faster, and we might start to sweat. And this would be really helpful if we were in imminent danger, such as if a dinosaur was chasing us. But it's not so helpful when our brains are just worrying about maybe a health concern. But unfortunately, our brains don't know the difference between a dinosaur chasing us and having a health concern. And so it triggers the exact same bodily response. This feels really unpleasant, but it's completely normal and it's just our body's response to a situation that's making us feel anxious. The good news is that there's lots of things to do that can calm down this response, and we're going to talk about this in a bit more detail later on.
Some of us likely have been experiencing heightened worries lately due to COVID-19, also known as the coronavirus. The coronavirus is a virus which is a very small germ which cannot be seen. Germs are everywhere and there are lots of different types. Some are bad, but some are actually good. When a germ comes into our bodies, our immune system creates something called antibodies. When the same germs come into our body another time, our immune system will recognize it and use the antibodies to fight it. Without some germs, our immune system wouldn't be able to create these antibodies and we would be more at risk of becoming ill. And so some germs are really good for us.
So anyone can get the coronavirus, but we all experience it very differently. Some people might have a high temperature, they might get a continuous cough, or they might get changes to their sense of smell or taste. But some people might not even experience any symptoms at all, which is what we call asymptomatic. And some people don't experience any long-term problems and they recover pretty quickly. But others may be affected more severely, which is why we have to focus on keeping ourselves and those around us safe. There are lots of things that we can do to help protect ourselves and others from the spread of the virus. So when you're outside, you can do your best to keep a 2-meter distance between you and those around you who you don't live with. You can wash your hands, you can use hand sanitizer, you can avoid touching your eyes and your nose and your mouth where possible. And you can find all the latest up-to-date information on the guidance as to how you can keep safe on the government website, which is linked on the slide here.
The coronavirus completely changed up our lives, stopped us from going to school, seeing our friends and family, going to our clubs. There was lots of worries about health of ourselves or our loved ones. However, you have been feeling worried, curious, confused or sad is completely understandable. But while we cannot help how we feel when it comes to worries about our health, sometimes how we respond to these thoughts might be unhelpful. For example, if you started to become worried about your health, what might you do? With over 400 million people searching the internet every day, it is not surprising that the majority of us will immediately visit the internet and begin to search our symptoms in an effort to try and understand what might be going on. Dr. Internet provides convenient and quick access to information about our health symptoms, but this can lead to what we call cyberchondria, which is a word used to describe the anxiety from health information found online. Someone with cyberchondria might worry excessively about their health after searching the internet for medical information. They might typically seek out this information often, performing regular health and medical related web search frequently in a way that impacts on their daily life significantly.
A person might experience a pain in their chest. They might then start to worry that there's something wrong, and then they might go to the internet and start typing in all of their symptoms. That will lead them to lots of blogs, resource pages, and various other internet pages in order to investigate what's going on. This might provide that person with initial relief. It might feel really soothing to find answers for your symptoms. It might give you a sense of control. But this can backfire and can actually make you feel more anxious, maybe even unnecessarily. This means that we're more likely to go back and keep searching, and then we get stuck in a really continuous vicious cycle. People with health anxiety also likely to pay really close attention to their bodies and be really hyper aware of any pains and sensations. This close monitoring, this close monitoring of threats means that we are more likely to feel anxious and more likely to engage in hypochondria behaviors. Hypochondria is really important to be aware of because it can affect our well-being, mainly because it makes us feel stressed. We know that stress is linked with unpleasant symptoms, including headaches, tense muscles, increased blood pressure, and it can even decrease our immune system and make us even more likely to become unwell. Spending lots of time worrying and searching online about our health symptoms can also mean that we miss out on our life experiences, such as hanging out with friends or being able to enjoy family time. And lastly, research shows that searching up symptoms online is directly linked to an increase in anxiety.
As with most of our thoughts in our brains, hypochondria happens without us even knowing. But the good news is there are lots of things that we can do in order to overcome and change this behavior. It's important to think about different ways that you can respond to health worries in a helpful way. For example, we might want to schedule routine checkups with our doctor. This way, we are checking up with somebody who has medical training to understand all the multiple complex factors that go into medical examination. You can also keep a healthy lifestyle, eating well balanced meals, exercising regularly, and getting a good sleep routine. Monitor how much online searching you are doing. Make sure you start to notice where, when, for how long the topic search. See if your symptoms become more intense when you are symptom checking. Lastly, take back control of your information sources. The news and internet share ongoing information that can be negatively biased and sometimes speculative. Too much negative news can be the source of more anxious feelings. To reduce anxiety, it is important to be aware of where you get your information from and how often you do this, as this will help you take back some control.
So we're going to show you a video now, which is kind of covering loads of different ways that you can respond effectively to the coronavirus, called Face COVID. We'll just get that up.
When we face a crisis of any sort, fear and anxiety are inevitable. They are normal, natural responses to any challenging situation infused with danger and uncertainty. Face COVID is a set of practical steps for dealing with such situations. F is for focus on what's in your control. You can't control what happens in the future. You can't control coronavirus itself or the world economy or what other people do, and you can't magically control your thoughts and feelings. Fear, anxiety, and worry are inevitable, but you can control what you do here and now. So let's focus on that. A is for acknowledge your thoughts and feelings. Silently and kindly acknowledge whatever is showing up inside you. Thoughts, feelings, emotions, memories, sensations, urges. With curiosity, notice what's going on in your inner world. You might say to yourself, I'm noticing feelings of anxiety, or I'm having thoughts about getting sick, or I'm having feelings of loneliness. And as you continue acknowledging your thoughts and feelings, bring in the next step, which is C, come back into your body. Find your own way of connecting with your physical body. For example, you might try slowly pressing your feet hard into the floor, or slowly pressing your fingertips together, slowly stretching your arms or your neck, or shrugging your shoulders, or slowly breathing. And as you acknowledge your thoughts and feelings and come back into your body, you then move to E, which is for engage in what you're doing. Get a sense of where you are here and now and refocus your attention on the activity at hand. Notice 5 things you can see, 5 things you can hear. Notice what you can touch and taste and smell. Notice what you are doing and give your full attention to that activity. And then C is for committed action. This means effective action guided by your core values. Action you take because it's important to you, even if it brings up difficult thoughts and feelings. Of course, this includes following official guidelines on what to do during this crisis. But in addition, ask yourself regularly, what can I do right now, no matter how small it may be, that improves life for myself or others I live with or people in my community? And whatever the answer is, do it and engage in it fully. O is for opening up. This means making room for difficult feelings and being kind to yourself. As this crisis unfolds, we'll all feel fear, anxiety, anger, sadness, guilt, loneliness, and so on. We can't stop these painful feelings from arising, but we can open up and make room for them. Acknowledge they are normal, allow them to be there even though they hurt, and treat ourselves kindly. Consider what are kind words you can say to yourself and kind things you can do for yourself to help you cope with this suffering. V is for values. Committed action should be guided by your core values. What do you want to stand for in the face of this crisis? What sort of person do you want to be as you go through this? How do you want to treat yourself and others? Your values might include love, respect, humor, patience, courage, honesty, caring, openness, kindness, compassion, or numerous others. Look for ways to sprinkle your values into your day and let them guide and motivate your actions. I is for identify resources. Identify resources for help, assistance, support, and advice. This includes friends, family, neighbors, health professionals, and emergency services. Make sure you know the emergency helpline phone numbers, including those for psychological help if required. D is for disinfect and distance. Remember to disinfect regularly and practice physical distancing for the greater good of your community. Please run through the steps of face COVID as often as you can for the benefit of yourself, your loved ones, and all the people in your community.
There we go. So hope you found that helpful to kind of think about different steps that you can take to respond effectively at this time.
As we mentioned earlier, the fight, flight, freeze response is our body's natural response to a situation that seems threatening. The physical side effects can be really unpleasant and can sometimes make our anxiety feel worse. But there are things we can do to calm our bodies down. This slide, you can see some ways we can manage our fight, flight, and freeze response. Acknowledge these extraordinary times and take it easy on yourself and everyone else. Every day, identify things that you're grateful for: a pretty sunset, chatting with a friend, listening to music, food in the house, and playing with family. Do something for someone else. Small gestures make a difference and make you feel better too. Get information on the coronavirus pandemic from trusted sources like the World Health Organization and BBC News, not from social media. Limit how often you check the news or spend time on social media. And finally, take time to slow down with some deep breaths, even a few helps. Seeing our friends is one of the best ways to take care of our well being, but it can be really difficult at this time to make it happen. But being cautious does not mean we have to cut ourselves from the world. We can still meet our friends, socially distanced for a walk, or staying 2 meters apart. And there are lots of ways to connect without having to see people face to face. In lockdown, we know that young people found it really helpful to arrange video calls with friends, phone calls, or simply text them.
Sometimes it's the way that we're thinking about a situation that makes us feel anxious or might make us feel even more anxious. So we might think that we're not going to be able to cope, or we might expect that things will go wrong, or be really overly critical of ourselves. And we can sometimes fall into certain patterns of thinking which are particularly unhelpful. So when you notice that you're starting to think in that way and worry, it can be really helpful to use a worry tree as seen on the screen here on the left, which helps you to check whether or not you can do anything about your worries. So once you've worked your way down the tree, you'll kind of get to know if you can or you can't do anything about the worry. And if you can't do anything, then the idea is that you let it go and you try and distance yourself with something that you enjoy doing instead. So trying out a distraction technique, such as focusing on something external instead of focusing on those internal thoughts that you might be having. So some distraction techniques might be looking around your room and listing everything in the room that is the color red. It might be baking something, you might watch your favorite movie, whatever it is that helps you to distract, and that's likely to be different for all of you. But it will help you to take your mind off all of those worries. There's also a strategy called worry time, which is where you set aside 15 minutes of your day every day and allow yourself that time to think through all of the worries. At any other time in the day, the idea is that you simply acknowledge that you are worrying at that time. You write them down in a worry journal, and then you move on with your day and perhaps use one of those distraction techniques that we just talked about. And then you only return to those worries during that allocated worry time. This means that your worry won't interfere with your day and take over, and it can be approached with a clear mind later on.
We know that when you are worried, it can be really difficult to remember all of these tips and strategies. And in the moment, we can get really carried away by the worries. Lots of young people find it helpful to create coping cards with all the strategies that you find helpful when you start to worry. These are cards which you can make for yourself and keep them close should you ever find yourself getting worried. Some ideas for your coping cards might be to draw, to listen to music, to talk to a friend, to do a hobby, to try a visualization technique.
Relaxation is an important aspect of well-being, and even more so when we're experiencing health anxiety. Breathing exercises are best used as a daily practice so that you feel calmer in your body over time. They can also help you feel calmer during the times of your worry by helping you to push through those moments. You start by taking a deep and regular breath in through your nose, really slowly, and then breathe out through your mouth slowly as well. We recommend doing this 3 or 4 times a day in order to help calm down your breathing.
You might want to try our body relaxation exercises like the one seen on the screen here. Progressive muscle relaxation is where you go through each muscle in your body, tense really tight for 5 seconds and release, noticing the difference between a relaxed and tense muscle, which can help us to feel more calm all over our bodies. I'm sure you have all heard of mindfulness. Mindfulness is a really important tool, especially when our minds are caught up in worries about the past or the future. It can help bring yourself outside of those thoughts and into the present moment. Find a quiet and comfortable place to sit and close your eyes. Notice how your breathing and body feel. Now, shift your awareness to the sensations you observe in your surroundings. Ask yourself, what's happening outside of my body? Notice what you hear, smell, and feel in your environment. Change your awareness several times from your body to your environment and back again until your anxiety starts to fade. There are lots of different mindfulness exercises online for you to use. A top tip would be that you practice this a bit like playing a musical instrument. It can take lots of time to master it, so stick with it and keep practicing.
And lastly, try out some physical exercise. So just like the one seen on the screen here, this HIIT workout, this is a really helpful way to create a healthy body and a healthy mind.
That brings us to the end of our webinar today, and we hope you have found it helpful to explore what health anxiety is and some helpful tips to overcome any health anxiety related difficulties.
Thanks for watching.